Rich, and you're watching CAN TV. We are here today with Tenisha Jones from Westside United, so thank you so much for being with us.
Thank you for having me.
So talk about what Westside United is and then about the work you do.
Well, Westside United, essentially, we bring together healthcare institutions that have come together to make their neighborhoods stronger, healthier, and more vibrant, and better places to live, essentially. Westside United seeks to decrease the life expectancy gap by 50% by 2030. We know that's an ambitious goal, a big, hairy, audacious goal, but we are working very hard and diligently to ensure that we increase the quality of life for residents on the west side of Chicago.
And so let's talk about that. So there are incredible disparities in health outcomes that we see in Chicago, even pre-pandemic, obviously. So your organization often cites what you just brought up, the life expectancy gap. So can you talk a little bit more about that?
Okay. It's a very complicated factors, right? We know that historical racism and disenfranchisement on the west and south sides of Chicago has really led us to really think about where each of these communities are as it relates to the life expectancy gap. And what I want to say about that is that those social determinants of health, we know that there are many factors that contribute to them. But the ones that Westside United in particularly is really interested and focused on centers around hypertension, high blood pressure, heart disease, cancer, infant mortality, and also maternal child health. And so those are the areas of which we have seen the data is telling us has had a profound impact on the west side of Chicago. And our 6-hospital collaborative is really created Westside United to combat these decades and decades of disenfranchisement and racism, essentially, that has led these communities to have these kinds of outcomes.
And so who makes up the 6-hospital network?
So the 6-hospital collaborative is made up of Rush University. We have Laurier Children's Hospital, Meta Health, Mount Sinai Hospital, and of course, the University of Illinois, UIC, who makes up the 6-hospital collaborative.
And so talk about what health equity looks like in Chicago, or what it should look like.
Okay. I'm going to start with, where we currently are. I think we all know that the pandemic has really exposed the social inequality around access to healthcare, how COVID-19 has impacted our communities on the west and south sides, particularly on the west side, in a very profound way. And it has been exposed that it is because of lack of access to quality healthcare, primary care, prevention care, also our community's inability to have access to fresh foods. There are many variables and many things that I can speak of. I could even talk about the fact that literacy plays a huge role in some of these, these levels of disenfranchisement in our neighborhoods on the west side around the social determinants of health.
Right. And so you brought up COVID-19. So when COVID-19 first hit the US, there was widespread rhetoric around it essentially being an equal threat to all communities. So essentially that no one was immune to the disease and that it would impact all communities equally. However, what we know about access to healthcare and about health outcomes generally is that there is very little equity. So COVID-19 did not hit all communities equally, but had an incredibly disproportionate impact on marginalized communities. So the situation in Chicago is no different. So talk about the experience of Chicago communities on the west side with COVID-19.
I think I want to start with the inequities. We use this word equity so much in so many different ways right now, in so many different capacities in different spaces. But inequities mean that you don't really have access to other things that people who are in a higher social economic status or bracket have access to. The inequities are, you can see them in plain sight. If you drive from the west side of Chicago into the South Loop, you can see a very, very big distinct differences in the way our communities look. What businesses are in our community, access to fresh foods again, grocery stores, all of those things, walkable spaces for people to walk and get out and exercise. You can, in plain sight, see the inequities in our communities if you compare them to some of the communities up north and their access to those things, right? And so when we talk about equity, we really got to kind of sort of, and some of this has been happening. We really have to really grapple with the fact that we live in one of the most segregated cities in the country. I love Chicago. I grew up here on the west side of Chicago. I've been here all my life, attended CPS schools, and I grew up in a segregated city, and it means something, right? Your zip code means something. Your ability for social mobility, to have access to a high quality education, all those things matter as it relates to the social determinants of health and also the life expectancy, your life expectancy essentially.
How has Westside United's work changed within the pandemic? So, I mean, you're essentially trying to change these systems, but we're in the midst of an unceasing pandemic. So what has your focus been?
So I think that's a great question and a great litmus test for us because Westside United was created in part to really mitigate all the things that COVID-19 has really exposed and put a sort of like a magnifying glass on. And so at Westside United, I think we were uniquely positioned already to respond to the COVID-19 crisis in a very unique way because we were already created to do exactly that. That's our mission. And so how we've been responding to the COVID-19 crisis is in several ways. The first way we responded was really ensuring that we supported our local pantries on the west side of Chicago. So our very first grantee was all centered around making sure residents had access to food. So we supported $100,000 to go towards pantries on the west side of Chicago very, very early in the pandemic. In March, actually, April, we were already galvanizing and centering ourselves to ensure that we were supporting pantries in the community to get food out to residents in the community. The second thing is that we, because of how we were positioned, the mayor's office, our mayor, Lori Lightfoot, reached out to Westside United to collaborate on creating what is now the Racial Equity Rapid Response Team, where Westside United is co-leading and co-partnering with the city to stand up essentially a collaborative of community leaders, health institutions, and also the city of Chicago coming together to create this Racial Equity Rapid Response Team that essentially is in a space where we're all collaborative and working together, but really the strategy and the focus is a hyper-local response where Westside United and the city is working together to provide resources to leaders in their community to actually work towards mitigating COVID-19 within their own respective communities, creating command centers in each of those communities on the west and the south sides of Chicago that became centers for things like food pop-ups, that can be centers for PPE, for education and sharing and debunking myths, and coming up with all different kinds of strategies like town hall discussions and bringing people together to really galvanize what's real, what's not, and ensuring that our community leaders had resources. Our community leaders needed resources, they needed staff, capacity, and also support to really lift up the work that was possible in each of those communities. And that work is still continuing now. The Racial Equity Rapid Response Team is still meeting once a week where we strategize around things like contact tracing, how do we prepare for the winter with flu shots, and really trying to figure out what the contact tracing is going to look like and how to collaborate with other entities across the city, as well as other entities, other community networks, I should say. And so the work of the Racial Equity Rapid Response Team has been truly a space and a place where we brought a unique group of people together. This space has never been created before, where there's health institutions, FQHCs, community leaders, there's the government, and then there is also this resource group that is working with philanthropic as well as corporate partners to bring in resources around hyperlocal supports and strategies. And I should also note too, I want to make sure I'm very, that I'm clear about this, because we feel really fortunate that so many people put their trust in us, including the mayor, to help co-lead this work. We also received some funding from the Oprah Winfrey Network, where we were able to create the Live Healthy Chicago Collaborative that is mostly focused on the West Side communities. However, we received resources and funding to put out an RFP where any 501c3 could apply for resources to mitigate COVID-19 in their respective communities.
And so how do communities move forward from here? So, I mean, do you think that this moment, which has been incredibly painful, will be a catalyst for policymakers and healthcare systems to take a more serious approach to dealing with the inequities that we've seen?
Absolutely. I think right now we're at such a critical moment. We've seen so much death. This has been a tough year for all of us, but particularly in Chicago, on our Black and Brown communities, even as we think about the fact that our students, our kids in Chicago have been out of school for almost a year. Our kids were already, behind in reading and math, and in math in some instances, as more kids are graduating, but we know from the data that our kids still need much, much more support prior to COVID-19. And now with them being out for almost a year without, having access to high quality instruction, that there will be an untold impact on our children and our families for years to come. And so I believe that we are in a critical space. We cannot go back. We should not go back. We should be thinking about, how do we get better? How do we change some of these systems that we know were not equitable and did not create, it does not and has not created real opportunities for everyone to thrive, no matter where you live or where your zip code is. And so what I hope to see, and what I hope that comes out of this, and part of our work is to ensure some of these things happen within our own capacity, is that we see that corporate partners, philanthropy, government, we're all going to have to come together and be very strategic about how do we work together to really start to dismantle some of these systems that we know are not working for people across the board. And so I'm actually hopeful that COVID-19 has taken a toll on our communities, but I do feel like this is an opportunity and a time for us to really look at our systems. Are we really doing all the right things that we could be doing to ensure that everyone has access to a high quality of life in Chicago?
Right. And so I think to close, where does the work that you do at Westside United go from here?
Oh, wow. Well, that's a big question. So where our work goes from here, again, we're in an interesting space, because we're a 6 hospital collaborative that's coming together to improve the quality of life of our residents. Westside United is also a convener that can bring people together to get big and bold things done. And so where we're going is continuing to work with government, with philanthropy, with all kind of public-private partners. We really want to figure out this corporate thing. I think corporate could play a much more critical role in helping to support communities in a way that they have not done in the past. We'll be advocating for those kind of relationships to develop and infiltrate down into our communities to begin to support our communities in a different way. We'll be in the incubation space around education and supporting neighborhood schools who we know are going to need this extra support of wraparound resources, as well as some solid, tight strategies around how to really use neighborhood schools to be fulcrums of many different things can happen inside of schools, right? Even as it relates to our parents around workforce development and getting people back to work. So there's a lot of work to do, a lot of work for Westside United to do, and we'll do that work for, and alongside our communities and partners.